92.7 KGBR. It is the bridge to all great listeners here on the Wild Rivers Coast. Thank you for joining me on the show this morning. And also joining me on the show this morning, we have a special guest. I'm going to go ahead and let her introduce herself because I'm not even sure she needs an introduction. We got some famous people on a board here that have gotten a lot accomplished, and she's going to tell us a little bit about that. Good morning. Tell us who you are.
Hi, I'm Deb Wilson, and thanks for letting me speak today. I'm currently on the Health District Board, and I've been on the board for over 4 years now.
Tell us about the Health District. You've been on there for 4 years. What exactly does the Health District do?
Well, the Health District provides several services. They, of course, run Curry General Hospital, and then they have clinics in Port Orford and Gold Beach and Brookings. We call ourselves the Curry Health Network because Brookings actually isn't in the district. But for this election, it's just the district voters that are going to be voting. In the last few years, I feel the board's really accomplished a lot. We've really turned the network around and are just on the brink of some really fantastic things happening for healthcare in Curry County.
Let's talk a little bit about that, like, maybe a new hospital, something like that?
Yeah, like the new hospital. I don't know how many attended the groundbreaking last week, but it was very successful, and we're very, very excited. We had a huge turnout, and if you drive down 4th Street now, you'll see the hospital all caged in and Erdmann signs all over the place, Erdmann being the architect, design, builder. Right. And many exciting things are just about to happen there at the site. And for those who aren't paying attention, the new hospital is going to be on the same site that the current hospital's on, and the current hospital will continue operations.
In the meantime, right. And it had
in the
to
meantime.
Be,
and we have to because we
way.
have to keep the money flowing in.
Right.
Absolutely. We got to continue to provide services.
Kind of like coming to fruition after a long, hard travel, things you guys worked really hard for.
Yeah, we've been working on this, and the fact that we're actually bringing it to fruition is, I think the whole community is just very proud of that.
Finally thing. Is this, you said you've been on there for 4 years. Is there a learning curve to this? How important is that, do you think?
There really is. Healthcare is probably one of the most complex industries around. And of course, as you know, it's constantly changing. We have new Affordable Care Act laws, and that's changing the whole framework of how we do business. And so it's really being up on all the laws. My background is in human services. I was Curry County Human Services Director for over 6 years, which was mental health, developmental disabilities, and alcohol and drug programs. And so I came to the board with what I feel is really relative knowledge to the challenges the health district faces every day. And that would be really hard and very difficult to find professional staff in a rural area like this, not only being able to recruit them, but to retain them. And the communities really want services in their own areas. And so it's also very challenging for us to be providing services in Brookings, Port Orford, and Gold Beach so that everybody feels like they're getting the services that we've promised them.
Right.
And so that's part of the challenges of, providing services in a rural area like this. And when I was director at the Human Services Agency, we had all the same problems. The other thing that I come with experience is the understanding of Medicare, Medicaid, Organ Health Plan, because we dealt with all of that private insurance when I was in the mental health at the county, and billing, legislative issues, organ administrative rules, all the things that there's so many regulations that the health district has to follow that there's a real need to know some of this. And so there is a huge learning curve. And the one thing that we just had recently is we just had some extensive training through Bill Sharney, who's a national expert in board governance. And this was 3 days of intensive training. The whole board attended. We really, really found out truly what it is to be a board, a governing board, and not an operational board. Big difference. All the board currently is on that same page. We've got new policies, we've got new bylaws, and it's really given a much stronger guidance to what our roles and responsibility is to the patrons of the district and to the health district administrative staff. So there is a lot to learn. I'd say a new person on the board who doesn't have any background, it's probably a good 18 months to 2 years.
Are you guys a good team right now?
We are a fantastic team. We've all been through the same training. We all understand the strategic plan, where we're going, and really understand the importance of, I think people probably heard that we're going to be putting in an emergency room in Brookings. And I know that's fairly controversial depending on who you talk to, but it's really understanding what is going to make our current district viable and continue into the future. And bringing the emergency room into Brookings, doing the Brookings Clinic down there, has been and will be with this new development an economic boom for the communities and will really help keep the current district viable into the future. We'll be able to bring in a lot more professional staff. You're going to see a big rise for us trying to recruit professional employees because we're going to need a lot more employees, which will bring in some family wage jobs,
More jobs.
kids in the schools. It will really, really make people want to live in Curry County because health care will no longer be there. One reason why they don't. The quality of our health care has really gone up.
Really building the desirability of the area itself in general.
Absolutely. We hear a lot from the realtors that people just decide not to live here because they don't feel that the health care has enough to offer.
Right.
And so as we continue to build our services and bring in revenue, it will definitely bring in more specialists. And so people will not have to leave the area. They'll be able to get most of the services here in Curry County. I mean, we're never going to be a cardiology center, but we do hope we can eventually serve dialysis patients. That's definitely one of our goals, and I know it's a huge need in Curry County, and maybe offer some infusion therapies, chemotherapies, things that people typically go out of the county for.
Have to go quite a distance out of the county
do.
for it, right?
They
and that,
do,
that
right.
builds up expense. It's hard on somebody who's already ill in many cases, so it's
Right.
not a good thing. And I think that's definitely the direction we want to work for. So tell us a little bit about the health district. Who exactly is going to be voting in this?
Well, from the north, it's Elk River South, all the way down to the Pistol River boundary, I believe.
Okay.
And that's what composes the district.
Okay. Now, is there any other area that you guys think that you guys have been doing a lot of work in that maybe some people aren't aware of?
Well, yeah, actually, it's fairly new, and we'll be talking more about this. But just last week, we had a meeting with the Brookings mayor and the city council, and we had just passed a resolution to go to the voters to ask to bring Brookings Harbor, I guess it would be south of Pistol River, to the California border into the district. Because if we do this emergency room, we will want it to be able to provide true emergency room services. And in order to do that, we need the voters of Brookings and Harbor to weigh in to become part of our district because we won't be able to do it without that revenue.
That's just some of the things that you're working on.
This is some of the things.
What about the Port Orford area? I understand there's some things on tap there.
Yeah, well, in Port Orford, one of the things that we've been really struggling with and I'm still very much concerned about is we wanted to put in either a nurse practitioner or a physician assistant up there to work with Dr. Pitchford because, number one, it's a rural health clinic and we need to have that second provider. And so we're really trying to find another practitioner to come up and provide services at the Port Orford Clinic. But we are really trying to find somebody who wants to live in Port Orford in the community and who we feel can provide the necessary services. And if we get that, then we're hoping to keep the clinic open on Fridays and hopefully Saturdays so we can have more of a drop-in type of center for the people in Port Orford. The other thing that we've done, I think since the bond passed, is we've been giving people gas vouchers so that if they need to come down to Gold Beach for any of our services, that all they have to do is pick up a voucher when they get to the receptionist desk. And then they can get a gas voucher and they can get their tank filled here in Gold Beach or in Port Orford. Right. And people have been really using that.
I know that people have been using that. I've heard good things as well, and that is unheard of. That is one of the neatest programs I have seen instituted in this kind of situation ever in my entire life.
I'm glad to hear that because we think it's the best we can do for now. We'd like to really get those services up there. I heard that Dr. Shea, who's our new orthopedic surgeon, is perhaps going to start going up there on Fridays or sometime during the week if he can get a schedule set up. And so for people in Port Orford, if you need to see an orthopedic surgeon, he's available to come up and do that. That'd be really exciting. One of the other things that we've accomplished that we're really excited about is that we've contracted with a group who's very experienced in delivering assisted living care services to Shore Pines, and they're going to be putting in a memory care unit at Shore Pines. So now residents who live at Shore Pines, if they need memory care, they can stay right where they're at in Gold Beach. Their family can visit them, and they won't have to travel out of town. So we're very excited about that, and the public should see that happening within the next several months.
So what would you tell somebody that wasn't sure which way they were going to vote? What would you say to them to convince them that you are the person for the job?
Well, I think the biggest thing is that I'm the one on the board with the most experience. I think that really plays a lot into my favorability as far as I've been there, done that. We've made a lot of hard decisions in the last 4 years. And they're not always easy decisions. I've learned from that. I learned what direction we're going. And plus, my past work experience, I think, is important. I've heard people say that I have good leadership skills, and I've been in the community for a long time. I know a lot of people, and I think people think that I'm fair and true to my word, and I try to do the best for the public good. I'm just really dedicated to giving back to my community and want to stay on the board. I feel really a lot of passion for the projects we're doing, and I really want to see them through fruition.
Is there a place that people can go for more information if they'd like to learn more about you and your campaign?
Well, I know the health district has a website that talks about my background, but if you really want to know more about what I've said, I suppose you could give me a call, 541-247-7654.
Deborah, thank you so much for talking to us today, and we'll stay in touch. Maybe we'll talk again.
Thanks, Bill. Appreciate it.
Kgbr is the bridge to all great listeners here on the Wild Rivers Coast. Thank you for joining me on the show this morning. And also joining me on the show this morning, we have a special guest. I'm going to go ahead and let her introduce herself because I'm not even sure she